All right, 49ers fans. Well, what about Fred Warner, linebacker, week 6 versus the Buccaneers? He had an early first quarter collision. He had a right ankle injury. Looked pretty gruesome initially to start. And obviously, when we see that, that's generally what we call an ankle fracture. And this stance was not only an ankle fracture, but an ankle fracture dislocation where the joint comes out of place, it fractures. And usually you get fractures both on the outside of the ankle, inside of the ankle, and then around the ankle joint, you get a lot of the ligaments that are injured, especially the lateral posterior part of the ankle and as well as the medial side of the ankle. In addition, the syndesmosis, which is the space between the fibula and tibia bones, can be stretched and injured. And so these are surgically treated generally with what we call open reduction internal fixation. We put plates, we put screws on and fix the fibula bone in general, the tibia bone in general, and then also repair the ligaments and or the syndesmosis as needed. Based on how many ligaments are injured and the overall severity of the injury, these are generally around 6 months to return to play. Unlikely he's coming back this season, but we will see him back next season. Dak Prescott went through this. You actually saw that he had a small open injury, Dak Prescott, where he had a small amount of blood on the sock. You may remember that. But anyway, Dak came back that next season and did real well. So we're going to see Fred back next year for the 49ers. They're definitely going to miss him because he's their defensive signal caller and is in their coverage hub. And the loss really impacts Green Dot Communication, how they do things. So they're going to have to make some changes coming into their next game. But 49ers fans, rest assured, we'll see Fred back next season. And in general, these ankle injuries, especially after fixation, repairing the ligaments anatomically, actually do quite well that next season back.